Hello, and welcome to the web videocast on egg donation from the Reproductive Science Center of the San Francisco Bay Area. I'm Dr. Susan Willman, reproductive endocrinologist and infertility specialist. It's often been said that when human conception, when sperm meets egg and creates an embryo, is truly one of the miracles of nature. There have been great advances in technology in treating men with low sperm, when in the past it would not have been possible. However, one of the major challenges in the field of infertility has been treating women who have either poor quality or low numbers of eggs. This is especially true in women over the age of 40. As women become older, the number of eggs remaining in the ovary decreases. In addition, the quality of the egg decreases with age. The major effect of aging the egg is the chromosomal number is more likely to be abnormal. This translates into a chromosomally abnormal embryo. Down syndrome, which is an extra chromosome 21, occurs with increasing frequency in older women and is one example of the type of abnormality we see in older eggs. Some women experience low egg number or poor egg quality at a younger age. Genetic factors, most poorly understood, may be responsible in these cases. Other women have lost normal ovarian function due to tumors or endometriosis. Science has not yet discovered how to improve the quality of eggs or how to regenerate eggs. But we have discovered that women can conceive by receiving an egg donated by another woman. For women in such circumstances, egg donation is often their best option towards having a child. If you consider the donation alternative, you should take comfort in knowing that you are not alone. More than 1 in 10 couples undergoing assisted reproductive technology procedures use donated sperm or eggs to increase their chances of conception. At the Reproductive Science Center, we offer a comprehensive egg donor program with an egg donor team that has coordinated nearly 1,000 donation cycles. Let's look at some of the factors in egg donation. One advantage of egg donation is its comparatively high pregnancy rates. Here at RSC in 2007, we saw a success rate of nearly 70% with fresh embryos and nearly 50% rate with embryos that had been frozen. The good news is that women faced with the challenges of decreased ovarian function can conceive, carry a pregnancy, and give birth and have a healthy child. Choosing a donor can be a difficult process. Most egg donors are anonymous and are recruited from the community. At RSC, all program donors remain anonymous to the recipients. Our program donors are women in their 20s and early 30s who offer to help other women out of a strong sense of altruism. Anonymous donors go through an extensive screening process. They're evaluated for their general health, their family history of health problems, as well as individual psychological and genetic evaluation. In addition, there are strict guidelines regarding testing for infectious disease. And they're also evaluated for the fertility status with testing of FSH levels and ultrasound assessment of antral follicle count. Egg donation is a very time-consuming process, and donors are compensated for their participation in the medical treatment, which involves taking medications that are injections, having pelvic ultrasound exams, blood tests, and undergoing a minor operation to harvest the eggs. To ensure we get donors who are participating for the right reasons, we use nationally accepted guidelines that limit their compensation. Of course, you may consider a close friend or family member for donation if you like. Such a person is called a known donor, and there are important relationship issues to consider. Specifically, what is the strength and nature of your relationship with that person? If she's married or in a long-term relationship, how would her partner feel? And what are the communication and relationship patterns in your extended family? It is essential that the donor chooses to help you without any sense of coercion. While a family donor has the benefit of shared genetics, the interpersonal dynamics can be extremely complex. Selecting a program donor is a very complex and important process, and it is our job to help you through the donation process, including both medical and psychological screening. Counseling and continuing communication among all those involved will help you work through these relationship issues. Sometimes this process takes as long as 2 months. To learn more, visit the donors section of our website by navigating under the Egg Donor tab, go to Recipient Information, then click on the Online Donor Database. So, how does egg donation differ from other infertility treatments? The procedure is very similar to that of conventional in vitro fertilization, or IVF. First, medications such as Lupron or oral contraceptive pills are used to synchronize the donor and the recipient's menstrual cycles. Then the donor receives the fertility medications to stimulate her egg follicles. At the same time, the recipient takes estrogen and progesterone supplements to prepare her uterine lining for implantation. Once the donor eggs have been retrieved, the eggs are inseminated with your partner's sperm or with donor sperm. The resulting embryos then grow for 3 to 5 days in our laboratory, and a physician transfers them into your uterus. Normally, an egg donor will produce about a dozen eggs. Usually 70% will fertilize and develop into embryos. 1 to 2 embryos are transferred into the recipient's uterus. In many cases, there are extra embryos that can be frozen to be used in the future. 2 weeks later, you take a pregnancy test to see if the procedure was successful. Even after you become pregnant, you need to keep taking estrogen and progesterone supplements to help the uterus maintain ideal conditions for a successful pregnancy. Once blood tests have shown that the placenta is able to support the pregnancy, you can discontinue the estrogen and progesterone treatments. A big part of the donation process is the decision of sharing information. Some couples decide to keep this information entirely confidential, even among family members. Others are completely open about having used donors. If you decide to reveal this information, the first people to tell are those you think will be most supportive. You should be very clear with them about who you plan to tell and ask them not to speak to anyone else about it. Expect that as you inform people, some may have negative reactions out of their own fears, beliefs, or lack of knowledge. If they are close to you, you may want to involve them in some aspect of the process so that they can better understand it and support you. While you may want to move cautiously in sharing with others, being open has the advantage that you then have nothing to hide and less concerns about others learning about the donation accidentally. Though it is realistic to worry about reactions of the world to a child born through egg donation, we can also expect that there will be increasing acceptance as time goes on and more children are born through this and other assisted reproductive technologies. There's much to explore and consider about this topic before taking steps towards donation. If you're interested in learning more, please click onto the link to podcast so you can download an audio recording with more details. Or point your mouse at the button Egg Donation at the top of any page. You may also simply type the words egg donation in the search box. From everyone at the Reproductive Science Center, thank you for spending time with us to hear more about egg donation.